What is the melanoma risk of acquired versus congenital moles? Many people wonder about the chances of developing melanoma from different types of moles. Understanding the differences between acquired and congenital moles can help you stay alert and take action when needed. Melanoma is the most serious form of skin cancer, and early detection is key to successful treatment. Moles, medically called melanocytic nevi, are clusters of pigment-producing cells in the skin. Most are harmless, but some can turn into melanoma. The risk depends on whether the mole was present at birth or appeared later in life. Acquired moles are those that develop after birth, usually during childhood or adolescence. They are very common, and most people have several. The majority of melanomas do not originate from pre-existing moles. In fact, only about a quarter to a third of melanomas develop from existing moles. Instead, many melanomas appear on normal-looking skin. Having many acquired moles, especially more than 100 in adults or 50 in children, slightly increases the overall risk of melanoma. Atypical or dysplastic moles, which look different from common moles, carry a higher risk, especially if someone has several of them. Congenital moles are present at birth and can vary greatly in size. The risk of melanoma depends heavily on how big the mole is. Small congenital moles, less than 1.5 centimeters across, have a very low chance of turning into melanoma, generally less than 1%. Medium-sized congenital moles pose a slightly higher risk but ranges low. Large congenital moles, especially those larger than 20 centimeters, often called giant congenital nevi, carry a much higher risk. In these cases, the lifetime risk of melanoma can be 5% or more. The risk is highest during childhood but can occur at any age. In summary, most acquired moles are benign, and their individual risk of melanoma is low. However, having many or atypical acquired moles can increase your overall risk. Most melanomas do not develop from pre-existing moles, but vigilance is still important. Large congenital moles, especially giant ones, have a significantly higher risk, making regular skin checks essential. Changes such as rapid growth, irregular borders, color shifts, itching, or bleeding should prompt a visit to a healthcare provider. For large congenital moles, close monitoring by a dermatologist is often recommended, and sometimes removal is considered based on individual risk factors. Genetic and environmental factors also influence melanoma risk. Some people inherit genes that make them more prone to developing many moles, which can raise their risk. Other genes affect skin pigmentation and melanoma risk independently of moles. It's important to remember that melanoma can develop in skin without visible moles, so awareness and regular skin exams are vital for everyone. In conclusion, while most moles are harmless, understanding their types and sizes helps identify those that need closer attention. Regular skin self-examinations and professional checkups are your best tools for early detection. If you notice any changes in your moles or new skin growths, consult a healthcare professional promptly. Early diagnosis can make a significant difference in treatment success. Always seek personalized advice from a qualified medical provider, especially if you have many moles, atypical moles, or large congenital moles. Staying informed and vigilant helps protect your skin health and reduces the risk of melanoma.